So health anxiety actually comes up often with patients that we see. And again, it's not that anxiety is the cause of their problems. That's not where we're coming from, but actually that more that when you live with chronic health issues, health anxiety develops. So anxiety meaning that there's uncertainty, caution, um, um, uh, this nervousness, this unknown that develops, can develop from many factors, years of not being diagnosed, often misdiagnosis, having seen many medical providers, and also potentially social media and engagement in social media groups can also foster this for people at times, um, from the aspects of too much information and the much information not giving answers. So it ties into uncertainty. So health anxiety does factor into patients more and more in the modern age of medicine, where people are bombarded with information. And is this me? How is this me? How's this tie into me? And how's this data tie into me? And probably even more relevant during the time that we're in currently, um, through where healthcare access can be challenging for people. So the reason I bring this up for is that people often bring this up in appointments that they notice they have healthcare anxiety when they come to an appointment, feeling this sense of not knowing what to expect, um, even though we may lead the visit and tell them what they might expect. There is a sense of unknown and uncertainty. I use those words because they're very encapsulating and descriptive of what people can feel. The patient might feel still sense of doom, nervousness, fear, hope still could be present. Physiologically, you can feel like you can't think as well, blocking your thinking. Your heart might race, you get butterflies in your stomach and other physiologic symptoms. You might not be able to recall things as well. It can also trigger many bodily other symptoms, and again, inability to think. So one of the important things of health anxiety is to be aware that this could be occurring, and again, what can lead to susceptibility to this. And the reason why I bring this up is that it's so important to address because it can become interference to the road to doing well and recovery and reducing other symptoms, because it may block your ability to allow knowledge, information to come in. We actually have group appointments where we actually give much information and knowledge is power, knowledge is empowerment, and people might not be able to receive the information because it can be triggering health anxiety. Is this me? How's this me? How's not me? Again, it might not all this information tie into somebody, but again, we're trying to give information to help people. Or in a medical appointment that you might take, it might create other feelings of the past, or again, the uncertainty, but you want to be mindful that health anxiety might be triggered and create those feelings, and you might miss the opportunities. So simple tips can be is being mindful of this. Other patterns that people might notice in health anxiety is over social media, over internet searching, sometimes going to social media groups and looking for information that leaves you unresolved. That sense that you never really get that answer is a sort of a sign that you might have some health anxiety, that you never get that answer resolved. Even through testing can actually create that. That testing never gives you that sense of completeness, that gestalt wholeness can leave you rendered in that feeling. That's a sort of a warning sign of health anxiety, that even with the testing or social media or patient email portal or visit, that you never really feel like you're settled. That can be a sign of health anxiety, that you never feel that complete resolved feeling. So if that is ongoing, we do recommend tools to help people, like health psychology. It's a great tool to get people, to get them over that hurdle. Sometimes people do need that. And if you don't feel you need that, sometimes being willing to embrace that you're experiencing this, embrace that you're in the moment, say, I'm going to receive that information. Two is also practice breathing. Exercise helps. Write down 1 or 2 questions that you want to address in the appointment, very concise visit, maybe 1 or 2 goals in the visit. So if you come to like a group education appointment, say I'm here to receive at least 1 or 2 points of knowledge, or at least be proud of yourself, acknowledge that, hey, I did this, celebrate your successes. So again, this is not all the tools for health anxiety. It's more of an awareness video to know that people who've been through chronic health issues, especially in a long road to journey of diagnosis, can lead people in a vulnerable state to this. And this is being respectful and acknowledgement, not to label in a negative manner. We're trying to honor what people are going through and to help them in this journey. So we appreciate you listening to this. There are many videos on this channel, and we're trying to help people along here. So thank you for listening, and bless all of you.